As a person with a disability relying on a wide variety of Minnesota healthcare programs administered through the Minnesota Department of Human Services, and as a former member of the Health Services Advisory Council, I urge the Minnesota Governor's Office, Minnesota Legislature, and healthcare innovators across Minnesota to come together to discuss how might we ensure our shared core values of compassion, wisdom, and persistence are adequately reflected in our public health and human service programs. Based on my experiences working with the Health Services Advisory Council, which was organized by Dr. Jeff Schiff and supported by Ellie Garrett during my tenure, I feel the Council is one of the most valuable tools Minnesota has to address the widespread, complex health challenges facing Minnesotans. These topics have included opioid addiction, autism spectrum disorders, among many others. Most importantly, the Council performs its work in ways that are consistent with our democracy and our other shared core values of compassion, wisdom, and persistence. First, the Council is unique in the way it nurtures thoughtful and transparent discussions among our diverse collection of stakeholders. This increases mutual understanding, highlights common ground, and helps to unify innovators passionate about those particular topics. In fact, many work groups have spun off from the Council to continue work on those topics well beyond the Council's involvement. Second, the Council is unique in its focus on evidence-based solutions. Examining our global collection of research helps to educate our communities, fuel deeper exploration, and to energize local innovators. The Council's policies intentionally minimize bias, thereby greatly increase the likelihood that solutions available to Minnesotans will be impactful and sustainable. These solutions help us better support the health, safety, and dignity of Minnesotans both today and for future generations. These solutions not only benefit Minnesota healthcare program clients, they also benefit most other Minnesotans as large health insurers and health networks adapt these solutions for their clients. And these solutions have the potential to offer benefits nationally and globally when the knowledge is shared with other communities. In reality, the Council is similar to an evidence-based, multi-stakeholder hub of innovation, an innovation catalyst. This suggests a possible question for discussion. How might we better organize healthcare innovation in Minnesota? How might we reduce our existing friction and barriers to innovation, which isn't unique to Minnesota government? How might we better empower innovation? How might we leverage the evidence and best practices around innovation similar to the practices used by the National Science Foundation, Innovation Corps, IDEO, Lean Launchpad teams, plus Acumen participants, and many others? For example, might we organize 5 to 7 facilitators into small, agile innovation teams focused on policy related to public health, safety, and dignity? A team similar to those at 3M, Honeywell, among many other long-standing groundbreakers and upcoming trailblazers throughout Minnesota. A team of community networkers, discussion facilitators, problem solvers, and solution designers that organize activities among our state's diverse stakeholder groups. A team with access to statewide health data, including diagnosis, utilization, and outcome data. A team that can diligently focus on helping Minnesotans, insulated from distractions, tensions, and frictions that are often associated with special interest groups, political parties, and government agencies. Perhaps a team coordinated by leaders who've consistently demonstrated compassion, wisdom, and persistence for Minnesotans while carefully juggling the natural tensions that multi-stakeholder projects involve, Traits similar to those shown by Jeff Schiff and Ellie Garrett? A team that provides annual reports, perhaps, and recommendations to citizens via the Minnesota legislature. A healthcare innovation hub that is primarily publicly funded, but also privately supported through foundation grants plus corporate and individual donations, acknowledging the public and private benefits of this unique approach? It's worth discussing these questions, especially since we're struggling with our current models of public innovation. Thank you for your consideration. Links to additional resources appear in the comment section for this video.